So for this video, we're going to be looking at 3 special tests that are used when looking at rotator cuff as well as impingement syndrome and or pathologies. Now, I use those as kind of interchangeable because recognize that impingement to rotator cuff disease or pathology is really a continuum. Oftentimes, rotator cuff pathology begins with subacromial impingement and other forms of impingement in the shoulder. So let's go ahead and look at these 3 tests. Specifically, we're going to be looking at full can, empty can, as well as Hawkins Kennedy. So for this, we're going to ask our patient to stand up. For a full can, imagine that you had a can of soda or other adult beverage, perhaps, in your hand. You would want to keep that can full such that you don't pour out the contents. And what you're going to do is you're going to ask your patient to come into a scaption plane. Now, it's important to stay in the scaption plane because we want to keep the humerus in line with the scapula. The scapula are not perfectly horizontal. They're 30 degrees into what we call the plane of the scapula. And so when the individual does this, they won't be fully abducted or flexed. They're in that scaption plane. Thumb up is a helpful reminder to remind them or encourage them to go into that full can location. And so we're going to ask our patient to adopt the full can location and to go as high as they can. Come back down and relax. Now we can query symptoms and ask, is it better, worse, no different with that? As well as looking for the quality of the motion. You can also come in and superimpose other tests such as a resistive isometric or manual muscle test. But for now, we're just going to look at that in terms of full can. Conversely, empty can is the exact opposite position. Now with the thumbs down, or as if you poured out the liquid in that can. Again, we want to stay in the plane of the scapula and we want to make sure that they're not bending the elbow but keeping the elbow straight. And so again, we ask them to go as high as they can. And so in this case, we can also give them the cue of pinkies up. Here again, we can ask for reproduction of symptoms, better, worse, no different. Or if we suspect a contractile pathology, we could provide some resistive overpressure or resistive isometric as well. And so we have empty can and full can. Sensitivity is quite good with these. If an individual can do these tests with no reproduction of pain or the remarkable sign, it's highly unlikely anything is wrong with the structures involved with these tests. However, if they're positive, it doesn't tell us a whole lot. We don't know if it's impingement, rotator cuff pathology, or some variation in between. The next text is Hawkins Kennedy, and we're going to have our patient adjust just a little bit so you can see this from the side. Hawkins Kennedy has been performed a variety of ways. However, we're going to show you one way and then also some of the variations, but ask that you do it the first way that we demonstrated. So what we're going to have the individual do is come up to 90 degrees of flexion. We're then going to have the individual release kind of the elbow and come into this position here. We then take them into maximal internal rotation. This reproduces a bit of that empty can positioning, and we ask better, worse, no difference as we do that. With the idea being that we're taking this monohumeral head and jamming it into the roof of the acromion. If symptoms are reproduced, again, doesn't tell us a whole lot. What type of impingement are we dealing with? What type of rotator cuff pathology might we be dealing with? So, Hawkins Kennedy. Others have also done it with the hand on the shoulder and then coming up. But that doesn't really get at the internal rotation aspect. So remember with Hawkins Kennedy, it's internal rotation with the elbow supported and then asking for reproduction of symptoms. So we have empty can, we have full can, we have Hawkins Kennedy. Have a go with a peer or colleague and let me know if there's any questions.